All right, thank you. Good morning, everyone, and thank you for being here. I'm Dawn Penich Thacker, co-founder of Save Our Schools Arizona, and we wanted to host this event because Arizona teachers, school staff, parents, grandparents, even students are in crisis over our governor's inaction on the COVID spikes, especially as relates to the status of our public schools. Our goal and what we're doing here today is to share information from experts and folks on the ground, unencumbered by PR teams or political alliances. And what we're doing is we're asking every concerned Arizona parent, grandparent, husband, wife, student, neighbor to do your part, including contacting the governor and your local school board and respectfully asking and demanding that lives are protected, the lives of teachers, staff, families, students, by returning to virtual learning in every instance possible. Now we'll hear from Dr. Susan Hughes.
Good morning. I'm Dr. Susan Hughes. I practiced family medicine in Washington State for 25 years before retiring to Arizona. I'm part of a grassroots medical provider group advocating for science-based health and education policy. In a blog post following the governor's press conference yesterday, public health expert Will Humble wrote, quote, "We're headed for an early or mid-December hospital capacity crisis, which will likely be worse than our summer fiasco, because there will be very few out-of-state healthcare workers to contract with. Our seasonal population of at-risk persons is increased now, and July represented the low point of our normal seasonal hospital capacity." We're holding this conversation today because we also have several hundreds of thousands K-12 students on school campuses, which we did not have in the spring or summer. We have teachers and staff getting sick, but are being advised to come in anyways. We've had multiple teachers as well as coaches die, as recently within the last few weeks. We have parents lying about their child's health status to ensure sports don't get canceled, and we have students terrified every day that they're going to bring COVID home to mom, dad, grandma, or grandpa. This is avoidable because Governor Ducey refused to act and pass the buck to local volunteers, our school board members. School boards can and must vote to return most learning and operations to virtual at Thanksgiving break. ASU, for example, has already mandated that quite some time ago. Our elected officials, our school board members who are volunteers, need to hear from us. Please be kind and respectful. They're in a very difficult position that they never were trained for. They're educators, they're family members, they're community members. They're usually not public health officials who are having to make these very difficult decisions. These people give up their time and energy to serve our communities. They're doing the best they can in a very difficult situation. The email tool to reach out to all of our school board members is sosarizona.org/stop the spread. Thank you.
Thanks, Susan. And now we're going to hear from a school administrator from the Casa Grande Elementary School District about operational issues.
Thanks, Don. Thanks, everybody, for joining us this morning. I am Robert or Bob Quinones, and I'm currently the Director of Leadership and Engagement for the Casa Grande Elementary School District. During the start of this school year, I've also kind of absorbed the interim title of COVID coordinator based on our current circumstances. And I say that to point out that anything related to COVID in our district is crossing my desk and through my department as I work through our 13 school sites, as well as our auxiliary service buildings to support all of our staff and all of our families. And as we look at these decisions about opening and closing schools, being in person or in distant learning models, I think it's important to consider things beyond that particular question, which seems to come with very easy surface level knowledge of classrooms being open, classrooms being closed. And I think we need to dig a little bit further into the nuance as it relates to classrooms being open and closed. And the logistical operations of that include so many individuals beyond teachers. When we hear about educators, oftentimes we just assume school teachers, and we have so many other staff members involved in the support of education. Here in our district, and I know in many other districts, we're focused on the student experience, and we work to keep that at the forefront of all of our decisions. That includes distant learning, that includes virtual learning and or in-person learning. And in the circumstances with which we're in, we need to consider how the student experience is impacted by the decisions that we make. In our district, we were able to establish some thresholds to respond to the situation that is arising here in our county, in our community, and in our state. We talk about staff members being in classrooms supporting students. And I think it's important to realize and have a conversation about what's happening in those classrooms when other individuals step in to fulfill those roles, because there's a requirement or expectation that teachers are absent from the classroom through quarantine mandates or personal health responsibilities that they need to take care of. Currently in our district, which involves about 6,000 students, we have currently, just in the teaching realm, right, certified teachers, 12 substitutes across all of our school sites, 12 that have agreed to participate in in-person learning. We have more than that in terms of certified teachers absent on a daily basis. We have only 5 of those individuals willing to be permanent subs for in-person learning. And so when we aren't able to fulfill those roles, we look at next level coverage to try and get support for students in those classrooms. Keeping that student experience at the forefront, we have people that are undercertified, underqualified, and we're grossly understaffed, not because we have a problem here in our district, but because of our current circumstances and situations. And historically, that's how education has worked well before pre-pandemic circumstances, especially here in Arizona. So as we think about the student experience, we want to ensure that learning is happening at the way that we expect. And when we say classrooms should be open, folks are often assuming that learning is happening the way that it was in 2019, 18, and beyond. And when we have different individuals in front of students, we're not able to support that learning in that same particular manner. When we talk about educators, I like to include everybody beyond the teaching realm. That includes administrators, front office staff, our ESPs or educational support professionals, our bus drivers, our mechanics. And when we have a circumstance that involves other individuals getting sick or unable to respond to the work situation, we end up in these unique situations where we don't have the capacity logistically to operate schools. When we have certain key individuals out, if we were to quarantine, for example, our diesel mechanics, we aren't able to respond to bus needs, therefore not able to transport our students to school, therefore not able to provide them the instruction and education that they're looking for within the classroom setting. And so I think it's important to look beyond just teacher and look at the title of educator and know how we are impacted as a school district well beyond just the classroom and the expectation of that classroom learning experience and that classroom environment. Keeping that student experience at the forefront and knowing every educator, not just our teachers, are impacting those student learning experiences through their action, through their conversation and support with one another. And so when we have to shut down schools, the capacity and the involvement that it takes to do so. I've watched the dedication from our site leaders and our teachers spend entire Sundays contacting families, over 400, 500 families and students, to ensure that they receive appropriate information that school is going to return to virtual learning on that following Monday because of expectations that don't allow us to effectively manage a school or run a school beyond just the instructional capacities, but the administrative capacities as well. So it's important to think beyond teachers and beyond the students, because we keep students at the forefront of our decisions for educational experience, but that's impacted by all educators, and all educators are impacted by what's happening right now.
Thanks, Bob. And next, I'm going to give my teammate a second to get a video ready. We have a nurse who works in the ICU COVID unit who got called into shift. So she sent in her part instead of being able to join us live because she's working this very issue. And while we get that video ready, if anyone hasn't seen the latest stats updated just today from the Maricopa County Health Department, every single school district in Maricopa County is, as of today, in the category of substantial transmission. So as of today, there is not a district in Maricopa County and in other areas, of course, that isn't experiencing substantial transmission. So now we'll hear from our ICU nurse.
Hey everyone, I'm a nurse here in the Valley. I also have children who are school aged in high school and in junior high. I just want to let everyone know that we're slammed, and this is no joke that COVID is out of control. Plus we have just all the regular winter stuff that we normally have. I'm just coming off shift and I am completely exhausted, as are all of my coworkers. There aren't good days at the hospital anymore. And I am horrified that people aren't doing their part. I'm horrified that our governor still hasn't said much in regards to even mandating masks, which at this point seems like a no-brainer. I'm saddened by the fact that science and deaths became incredibly political. And I'm just tired of everything. So obviously, you know, we saw a number spike when our kids went back to school. We're continuing to see that trend as our hospitals are lined with patients in the hallways. And that is not an exaggeration. That was my day all day today. So I'm asking you to do your part. I think at this point, the best decision is to keep our kids home until we have things more under control. I don't know. Email who you need to email your school boards, use the links provided, do your part. I've asked, I don't even know how many thousands of times for people to do their parts, and here we are. This is Arizona. This is my home, born and raised, and it's just really, really sad. So thanks for your time.
All right, thank you. Speaking of kind of that emotional toll, next we're going to hear from Catherine Tansey of Valle del Sol.
Thank you so much for having me. So my name is Catherine Tansey. I am the Senior Clinical Program Supervisor of School-Based Services with Valle del Sol. Valle del Sol is an integrated health center which provides both primary care and behavioral health services to families. We're a federally qualified health center, which means we do not turn anyone away regardless of their ability to pay. Our school-based program has been around for over 6 years now. We partner with over 50 schools in the Valley. What the school-based program does is we create partnerships with schools, relationships with schools, building that trust with schools so that we can better meet the needs of families in those communities as far as mental health goes, primary care. And through those partnerships, we're able to increase the accessibility of mental health services to families. Historically, we've provided mental health services on campus and off campus, both at our offices and on school campuses. Now we've gone fully virtual and then in the office. So we are continuing to provide mental health services through our partnerships with schools. I think one of the biggest things that, one of the biggest arguments right now about in-person is that mental health piece. And I wanted to kind of touch on that a little bit. I think we can all agree that in person is best in normal circumstances, and to say that we are not in normal circumstances right now, and we are trying to continue to support our families in this very difficult time. One of the things that we talk a lot about in our agency right now is that piece of collective trauma that we're going through as a community, and that there's a loss of safety and security. I think there is a belief that school is a place that is a place for safety and security for families. And sometimes there's a belief that that's the only place they receive that. And that is not true. And we want to expand and support those families outside of just the school environment to provide safety and security. And so we can continue to support families through our school-based services. Right now, what we're doing is we've seen schools continue to have those discussions with us about what's going on with their students. They are actively in touch with families about how they're doing through their mental health. And so what we want to do is just continue to have that open communication with schools about what's going on. So what we wanted to highlight, or what I wanted to highlight, is that mental health services for schools has not stopped during this pandemic and during school closures. In fact, we've seen an increase in virtual the usage of virtual platforms through mental health. We've seen families access mental health services more easily through virtual platforms. And our schools are continuing to have meetings with us about noticing families that are needing extra support, and we're continuing to support them in that way. And so what we've seen again is that schools care deeply about mental health for these families and kiddos, and they're having to hold that medical piece in mind while also holding that mental health, and we can do both at the same time. And I believe we can continue to virtually meet and office-based services meet families where they're at in their mental health needs while still maintaining medical health and safety in schools. If you have questions about whether your school partners with a mental health community partner, I'm going to share my email if you have questions about that, or if your family or your school is looking for mental health supports or questions about how mental health services or Vital Soul partners with schools. The best way to reach me is through school outreach at vitalsoul.com. You can also go to our website at www.vitalsoul.com.
Thank you so much, Catherine. So yeah, schools are not separate. Schools are part of our community, and the community picture is big and complicated. Thank you so much. Next, we'll hear from Dr. Isaac Martinez.
Good morning, everyone, and thanks for all the speakers. I've actually been listening and learning a lot this morning. I think it's outstanding information to be providing everybody. So a little bit about my background. I'm internal medicine and pediatrician by training. Born and raised here in Arizona. I was educated in Arizona, University of Arizona for med school and training at Maricopa Medical Center and Phoenix Children's Hospital here in the Valley. So I've been here a long time, since '99 actually. And I've seen a lot of health crises come and go. I will tell you that I lived through and worked through the swine flu and the issues going on with that, and this is significantly different. So currently I'm a medical director with Cigna, and I follow inpatient trend management and utilization. And what we've been seeing is a tremendous uptick in the number of cases of people being admitted for COVID on the inpatient side, and our bed day capacity diminishing significantly. And I want to talk about that a little bit in relation to how this affects you on a personal level. So I think everyone saw yesterday in the news, we hit 250,000 deaths here in the United States. And at this point in time, we have no indication that that's going to be decreasing anytime soon. We are affected here locally significantly with regards to COVID cases. But I want to make a real clear point that this is not just about people getting the virus. People think, okay, well, my risk factors for getting the virus are this, that, or the other. And if I get it, I don't really have any risk factors. Here's the thing. There's a certain percentage of individuals who get this virus that will require acute care hospitalization, acute care services. And that's either an emergency room visit due to respiratory complications or potentially having to be admitted to the hospital. Is it everybody? No. Is it 50% of people? No. But it's still a significant percentage. And I've seen anywhere from 7 to 15%. I don't think we'll know the true numbers until all of this is kind of past us. But the bottom line is that even a small portion of patients that are going into the hospital is adding to our overall total numbers that we normally see during a cold and flu season. So going into November, going through December, January, February, we normally see an uptake in hospitalizations, increased utilization, people with chronic illnesses. like COPD, like congestive heart failure. They develop what would normally be a simple cold for you and I, and they have complications to it. Now, are they going to pass away from that? Hopefully not, because they'll get the medical services that they need. But given the COVID environment that we're in right now, the number of cases that are going into the hospital and are utilizing those acute care beds that are finite is going up significantly. So remember, these are not an infinite amount of medical resources. The number of hospital beds we have in the Valley are finite. And if we overtax those with COVID patients, then we can't care for people who are going in for other conditions. So if you think about it, maybe your risk factors for COVID aren't significant, but maybe your risk factors for having a heart attack or a stroke are. When you're going into the hospital, you need to be seen within an hour for a heart attack, within about a 4-hour window for a stroke, for people to give you the proper medication and intervene and prevent major complications. If you're not able to get back and see a provider within those time frames, and we're already seeing people waiting in the emergency room for hours, maybe even a day or two for a bed at this point in time, now all of a sudden care is delayed and complications occur that didn't have to happen. That's not necessarily related to COVID, but it's a consequence of COVID taxing our medical system right now. And that's the piece that I don't think that people truly understand, is that conventional care that everybody's going to need, even if you trip and fall and break a leg, you might need to go into the emergency room and be seen. You're going to be waiting significantly, and you may have a complication because we can't get to you readily because our resources are tied up. And we just don't have the capacity to take on any more patients. We don't want to get to that level. And so we've got to do everything we can to mitigate the spread, to curb this, to flatten the curve as much as we can right now, and to keep it under control until treatments become available widespread, which they are. They're coming into development right now, but they're just not widespread. And number two, a vaccine, hopefully, crossing our fingers, is going to be rolled out fairly soon. But those are things that are on the horizon. We've got to weather the storm right now. And make no mistake, this is a storm, and we need to get through this. Otherwise, we're all going to suffer from this. So I'll leave it at that.
Thank you, Dr. Martinez. And then the last person we'll hear from to take us back to that school connection, a school board member who has made that decision of staying virtual. So Ilenia.
Thank you, Dawn. Hi, I'm Ilenia Ilad, President of the Osborne School District Governing Board. I'm here to talk about the difficult decision about closing schools and our district decision of remaining in virtual mode since then. We knew that moving to remote instruction would disrupt the education of our students and would create childcare problems for parents who count on their children being at school. We have learned since March that navigating remote learning is even challenging for a bilingual and biliterate parent like me. I can't imagine what our families who only speak a language other than English are going through. We have also learned that our incredibly talented teachers and district staff have also been presented with many challenges while learning to navigate remotely. I will always be indebted and grateful for the heroic abilities of our cafeteria workers, bus drivers, technology team, aide subs, behavioral techs, teachers, superintendent, and all district staff, which I missed, who made this chaotic situation bearable. The lack of leadership from our governor has left us stressed and anxious. We have all endured roughly 8 months of confusion about whether and when schools should be in person, hybrid, or virtual. These are difficult decisions being made by school board members and superintendents who are not public health experts. In our school district, we were lucky enough to convene a health committee who is making recommendations. However, I understand that not every school district has access to one. We would like to get back to in-person learning as quickly and safely as possible, but we know that this will not happen anytime soon. COVID-19 metrics have not headed in the right direction in our state, and we continue to have inaction by our governor. The process we use to inform our decision-making on continuing to remain in remote learning is guided by our health committee, leadership team, and by reviewing new metrics every Thursday provided by the Maricopa County Department of Public Health dashboard. There are 3 data pieces that are reported each week on the dashboard that we keep a close eye on: number of cases per 1,000, % positivity, and hospitalization from COVID-like illness. Well, we have been waiting for all three of these metrics to get to the green zone, signifying minimal risk of the community spread of COVID-19. At best, we have been able to get 2 of the 3 to green, with 1 still in yellow zone, signifying moderate risk of community spread. The dependable green metric, hospitalizations from COVID-like illnesses, has moved to yellow. Percent positivity in Osborne is nearing 10%, and cases per 100,000 are above 180. Our largest out-of-district zip code, 85017, has over 300 cases per 100,000 and a percent positivity at nearly 20%. We are not double the county cases, so we cannot completely shut down our independent learning spaces on campus, but all other school site learning functions are. The 7-day average has been around 1,300, and alarmingly, we have reached 2,000 plus cases for the past 2 days. And now that the data is hitting the dashboard in our district zip codes outside of Osborne, where large groups of staff students live, with some signs of the red zone or substantial risk of spread of COVID-19. We will continue to maintain the safe independent learning spaces mandated by the governor's executive order until we are able to apply for a waiver. The waiver is sent to the Arizona Department of Education, but will only be approved with MCDPH support. We can apply to MCDPH for the letter of support once our district cases per 100,000 exceeds twice the Maricopa County cases for 2 consecutive weeks. Right now, Maricopa County cases per 100,000 equals 185, so we could have needed to be at 230 cases per 100,000 this week to consider applying. Our collective voice and role modeling education leaders, it is critical to provide information to provide the actions required for us to be successful in managing this pandemic. I appreciate all of the efforts and sacrifices made on a daily basis for our students, families, and each other. I know it's not fair that school boards are being forced to make these decisions, and I know it's extremely difficult. But I encourage other school boards to follow the science and put safety first. The governor won't lead, so we must. Be bold in your decision making and confident in your values. Thank you.
Thank you so much, Yelenia. And actually, a question came in that I want to give right back to you, Yelenia, and maybe Bob, if you want to address this, and then another one for our medical professionals. The question is, recognizing the difficult position that school board members are in, how can families and community members support them in making that necessary decision while the numbers are skyrocketing? What's a way that families can help you and your school board colleagues, Yelenia?
Families can help by staying at home, wearing masks, teaching their children to wear masks, and trying to limit their exposure to the outside. That's the way that they can help. We're not going to improve in our city, in our state, in our nation until we start wearing a mask.
Yeah, I'd certainly be happy to add to it. In addition to those mitigating measures, be a part of the conversation and the connection. This isn't ending. The things that we teach our students to do primarily include critical thinking, and that involves considering the perspective of others. And I think it's important to have those conversations about the perspectives of others and realize that it's beyond what our personal beliefs might be, and realize there's a bigger picture here. Dr. Martinez mentioned that as well, that we need to consider some other factors beyond just what impacts us. We know that there are some perceptions for impact personally, but it's well beyond that. In the 32 minutes since we've started, I've received 2 text messages, 1 cell phone message, and a phone call, all of them COVID related, with an administrator that will be quarantining, a bus driver that is confirmed positive, and another voicemail pending, but I've received a text that I left you a voicemail COVID positive. This is not ending. It's ramping up in 32 minutes. 3 messages as it relates to this specifically. Be a part of the conversation, be a part of the action for yourself and for others.
Wow, thank you. And so to remind everyone listening, we've tried to make it easy to reach out to school boards and the governor. If you go to sosarizona.org/stop-the-spread, it's a 1-click button, and you can send an email to every member of the school boards of your area, there's also a button for the governor. If they have already made the right decision of going as virtual as possible, you can thank them through that button. Or if they need to hear from you, please be respectful and kind. These are unbelievably tough decisions that unpaid volunteers are being forced to do because of lack of leadership at the state level. But let them know you're concerned and what we need to do. It's sosarizona.org/stop-the-spread. And then there's another question, Dr. Martinez, maybe you could take a gambit at this. Someone is asking whether there are projections for how this looks, how high this goes, if we just stay the current course, or if we could make changes maybe.
Yeah, and I think the point is that, yes, it's within our power to make those changes. We control whether this gets better or gets worse at this point. And, just the point of the mask. I mean, this is simple stuff: hand sanitizer and a mask. This is not, rocket science. It's not complicated. Yes, I'd love a vaccine. Yes, I'd love treatment. Again, those things are coming. They're just not here right now, but they're on the horizon. So in the meantime, just wear the mask, use the hand sanitizer, distance, stay away from big settings like that. That will start to bring down the curve. How high can this get? Frankly, we don't know. Every week I look at it and I say, well, we hit our peak, and then the next week we hit our peak again. We've blown through the numbers in July that I'm seeing at this point in time. I don't know how much more capacity, though, our medical system can take before they start closing doors. And when I say I worked swine flu back in, I think it was 2008, I remember that we were very stressed at that point. And there was about a 2-week period where, we were just working around the clock. There were beds, doubled up in the hallways. But after about 2 weeks, we got a handle on it. We were able to kind of work through it. This is just nonstop. And I don't think anybody who's been in medicine for a long period of time has ever seen anything like this. The nearest thing was the 1918 pandemic. None of us were alive back then. This is unheard of in terms of the stress that it's putting on the healthcare system. And at some point in time, I wonder, does the hospital, does the ER start to say, we just can't take any more, we got to close the doors. And whatever happens at that point, you're on your own. I pray we never get to that point. And again, it's within our control to prevent that from happening, but we've got to be smart about this because frankly, there is no upper limit that I see right now. This is just going to continue to go until we make the proper, smart, science-based choices to stop it, to be smart and to really follow the science and use the mitigating procedures that we know do work at this point.
Great, thank you so much. Well, that was a lot of sobering information, but I think the takeaway and the reason we wanted to hold this is because we can do something about it. We can't do anything about other people's actions, but we can make sure our own actions are responsible and safe. Our school boards have the power to make these decisions because the governor has passed the buck to them, and they need to hear the support and encouragement of their community who they have stepped up to serve. Again, it's sosarizona.org/stop-the-spread. You can also, find them on Facebook. You can be calling them. They want to hear from the families that they serve, saying that you support virtual learning, that you understand it's necessary. And there are lots of talking points at sosarizona.org/stop-the-spread as well, if you want some help in how to communicate. We really are in this together. Thank you, everyone on Facebook, for watching, and please do your part and take care of yourselves as well. Thank you so much for joining us.